Imagine sitting in a room with your family. Dinner is almost over. Someone asks you a simple question, and for the third time this week, you forget a word you have used your whole life. Not a rare word. An everyday word. It just is not there. You lose your train of thought mid-sentence. You feel mentally slow, like your brain is wading through water instead of moving through air. Your family notices. They glance at each other. Someone asks if you are okay. Someone else asks, gently, if it is stress. Someone else, even more gently, asks if it might just be age. You laugh it off. But that night, alone, you do not laugh it off. You sit with the question nobody said out loud. But what if it was not aging at all? What if a brain scan, somewhere down the road, showed something that did not look like ordinary aging at all? Something connected, instead, to an autoimmune condition that most people have only ever heard described as dry eyes and dry mouth. Because in some cases, what looks like memory loss, what looks like confusion, what looks like the early signs of dementia, may actually be part of a completely different pattern. One that starts in the immune system, not in the slow wearing down of age. This video is not here to diagnose you. It is here to show you a pattern that often gets missed, so that if any part of it sounds familiar, you walk away with better questions to ask, not fear to carry. If that sentence just landed for you, if something in what I've described so far sounds familiar, I've put together a symptom map that shows exactly how this condition progresses, what shows up at each stage, and where the standard tests are most likely to miss it. Type symptom map in the comments right now and I'll send it to you directly. Because what I'm about to show you next is why that map matters more than most people realize, and why the stage you're in changes everything about what happens next. Let us start with the part almost nobody expects. For a lot of people, this story does not start with a diagnosis. It starts with small, strange moments that do not add up to anything on their own. Forgetting a name in the middle of introducing someone. Losing a word that was right there a second ago, so you describe around it instead. The thing you stir soup with. The place where you keep your shoes. Repeating a question or a story without realizing you already said it, until someone points it out, kindly or not so kindly. On their own, none of these moments mean anything. Everyone forgets a word sometimes. Everyone repeats themselves once in a while. But when these moments start happening more than once, more than twice, more than you can explain away with a bad night of sleep, something in you starts to quietly keep score. This is where the memory fear begins. Not with a diagnosis. With a feeling. For many people, the fear is not really about the forgotten word. It is about what the forgotten word might mean. Families notice this shift before the person experiencing it is ready to name it out loud. A spouse who starts finishing sentences without meaning to. An adult child who starts asking simple memory questions disguised as casual conversation. What did you have for lunch? Do you remember that movie we watched? There is a reason this particular kind of fear hits so hard. Memory is tied to identity. Losing track of words or names does not just feel inconvenient, it feels like losing a piece of yourself in front of the people who know you best. And because dementia and Alzheimer's disease are the conditions most publicly associated with this kind of forgetting, the mind goes there first, almost automatically. So people start watching themselves. Quietly testing their own memory in private. Trying to catch the slip before anyone else does. That quiet vigilance is exhausting in itself, and ironically, it can make concentration and recall feel even worse, because anxiety and cognitive performance are closely linked. Here is the part that matters most for this video. Memory and word-finding changes can come from many different sources. Normal aging. Sleep deprivation. Depression. Anxiety. Thyroid imbalance. Medication side effects. And, in some cases, autoimmune activity affecting the nervous system. Sjogren syndrome is one of the conditions that can sit quietly inside that list, often without anyone considering it, because most people only know Sjogren's by its two most famous symptoms, dry eyes and dry mouth. If memory changes have ever made you quietly worried about yourself or someone you love, type the word memory below. It helps shape future videos like this one, and it lets you know you are not the only one sitting with this particular kind of fear. Now we go deeper. Because memory slips are only one piece of a larger pattern that, in some people, can resemble cognitive decline. There are 5 symptoms in particular that tend to show up together, that tend to get explained away the same way every time, and that may, in some individuals, be connected to Sjogren's syndrome rather than aging or stress alone. For each one, we will walk through what it actually feels like to live with, what people usually assume it is, what may actually be happening underneath, and why it so often gets missed. Symptom 1. Word finding difficulty. The lived experience is specific. You are mid-conversation, the thought is fully formed in your head, and then the exact word for it simply will not surface. Not a complicated word. Often a simple, common one. You know the shape of it, the first letter, sometimes even what it rhymes with, but it stays just out of reach, like trying to grab something underwater. People around you fill in the blank for you, which helps in the moment and quietly stings afterward. You start rehearsing sentences in your head before saying them out loud, just to avoid the gap appearing in front of other people. What people usually assume is that this is simply aging, or that they are overworked, or burned out, or not sleeping enough. Family members sometimes assume early dementia, especially if there is a family history of it, and that assumption alone can create enormous anxiety long before any testing happens. What may actually be happening, in some individuals with Sjogren's syndrome, involves the immune system mistakenly targeting moisture-producing glands and, in certain cases, extending its activity toward nerve tissue and small blood vessels, including those that support brain function. This is sometimes described as neuroinflammation, inflammation occurring in or around nervous system tissue. It is not the same mechanism as the plaque buildup associated with Alzheimer's disease. It is a different process entirely, one rooted in immune activity rather than years of cumulative degeneration. Why it gets missed is simple. Word-finding difficulty looks identical on the surface whether its root cause is age-related, stress-related, or immune-related. Without specific testing, there is no way to tell just from the symptom alone. Symptom 2. Brain fog. The lived experience here is a kind of mental cloudiness that does not match how rested or alert a person feels otherwise. Reading the same paragraph 3 times without absorbing it. Walking into a room and forgetting why. Following a conversation but feeling like you are receiving it through static, a half-second behind everyone else. People usually assume this is burnout, lack of sleep, too much screen time, or simply getting older. And to be fair, all of those things can absolutely cause brain fog. That overlap is exactly why this symptom is so easy to dismiss. What may actually be happening, in some Sjogren's cases, connects to a combination of factors. Chronic fatigue from ongoing immune activity. Disrupted sleep caused by nighttime dryness, discomfort, or joint pain. And in certain individuals, more direct neurological involvement affecting how efficiently the brain processes information. Fatigue alone, separate from any structural brain change, can meaningfully affect concentration and working memory. This matters, because it means brain fog does not have to mean something is structurally wrong with the brain. It can also be a downstream effect of a body working overtime to manage chronic inflammation. Why it gets missed is that brain fog has no single cause and no specific test. It is a subjective experience, described differently by almost everyone who has it, which makes it incredibly easy to attribute to whatever explanation is most convenient at the time. Symptom 3. Sudden confusion. This one tends to be more alarming, both for the person experiencing it and for the people around them. It is often described as a kind of mental short-circuit. Momentarily forgetting where you are. Briefly not recognizing a familiar route while driving. Feeling disoriented in a space you know well, for a few unsettling seconds or minutes before things click back into place. People usually assume the worst here, and understandably so. Early dementia. A mini-stroke. Something seriously wrong with the brain. This is often the symptom that finally pushes someone to seek medical attention, because unlike forgetting a word, sudden disorientation is hard to explain away. What may actually be happening, in some autoimmune cases, relates to inflammation affecting blood vessels supplying the brain, sometimes described in research as small vessel changes, or to nerve involvement disrupting normal signaling. In some individuals with Sjogren's syndrome, this kind of transient confusion has been documented as part of broader neurological involvement, though it remains far less common than the glandular symptoms most people associate with the condition. It is important to say clearly that sudden confusion always deserves prompt medical evaluation, regardless of suspected cause, because the list of possible explanations is long and some of them are time-sensitive. Why it gets missed, specifically as something connected to Sjogren's, is that the standard diagnostic pathway for sudden confusion usually starts with ruling out stroke and seizure activity first, which is appropriate and necessary. Autoimmune causes are typically considered later, if other dryness-related symptoms are mentioned, or if standard testing does not explain what happened. Symptom 4. Mental exhaustion. The lived experience of this kind of exhaustion is different from ordinary tiredness. It is the feeling of running out of mental battery after a relatively small amount of thinking. Reading an email and needing to lie down. Following a meeting and feeling completely drained by the end of it, even though nothing physically demanding happened. Decision fatigue arriving by mid-morning instead of late evening. People usually assume this is simply being overworked, underslept, or stressed. Sometimes it gets labeled as laziness, which is particularly painful, because it is the opposite of what is actually happening internally. What may actually be happening connects to the chronic fatigue that is extremely common in autoimmune conditions, including Sjogren's syndrome. Persistent immune activity can be metabolically demanding on the body, and that demand often shows up as a kind of full system exhaustion that affects physical stamina and mental stamina at the same time. In some people, this is compounded by poor sleep quality caused by nighttime dryness or joint discomfort, which means the body rarely gets a true chance to recover overnight. Why it gets missed is that mental exhaustion is treated as a lifestyle problem rather than a medical symptom. People are told to rest more, manage stress better, or cut back on screen time, and while those things can genuinely help, they do not address an underlying immune process if one is present. Symptom 5. Balance changes. The lived experience here can feel subtle at first. A slight unsteadiness when standing up quickly. Feeling less sure-footed on stairs than you used to. Occasional dizziness that does not match any obvious trigger. For some people, this symptom is barely noticeable. For others, it becomes a quiet source of caution, avoiding certain movements just in case. People usually assume this is simply aging, inner ear issues, or low blood pressure, all of which are common and legitimate explanations on their own. What may actually be happening, in some autoimmune cases, relates to peripheral nerve involvement, meaning the nerves outside the brain and spinal cord that help coordinate balance and spatial awareness. When these nerves are affected by ongoing immune activity, the body's sense of position and movement can become less reliable, even when strength itself is unaffected. Why it gets missed is that balance issues are extremely common in general, especially as people get older, which makes an autoimmune explanation one of the least likely things to be considered first. Here is why this whole section matters. None of these 5 symptoms, on their own, point clearly toward Sjogren's syndrome. Word-finding difficulty alone could be 100 different things. Brain fog alone could be 100 different things. But when several of these symptoms show up together, persist over time, and exist alongside other clues we have not covered yet, the pattern starts to look less like coincidence and more like something worth investigating further. If any of this sounds familiar, whether it is one symptom or several, type the words brain fog below. It helps us understand how common this experience actually is. This is the part of the story where things sometimes shift for people. After enough memory concerns, enough confusion, enough exhaustion, many people eventually end up in front of a doctor requesting imaging, hoping for either reassurance or an answer. In some cases, brain imaging in people later found to have Sjogren's syndrome has shown specific findings. White matter changes, which refer to alterations in the brain's deeper tissue that helps different regions communicate with each other. Patterns consistent with inflammation in or around brain tissue. And in some cases, small vessel changes, referring to subtle alterations in the tiny blood vessels that supply the brain. Here is where we need to slow down and be extremely precise, because this is the part that gets misunderstood the most. These findings are not exclusive to Sjogren's syndrome. White matter changes show up in normal aging. They show up in migraine history. They show up in high blood pressure, in small vessel disease unrelated to autoimmune conditions, and in several other neurological conditions entirely. Seeing white matter changes on a scan does not, by itself, point specifically toward Sjogren's syndrome or toward any single cause. What these findings represent are clues, not proof. They are pieces of a larger puzzle that only make sense when combined with everything else: the symptom pattern, the blood work, the dryness history, and a clinician's full evaluation. A brain scan cannot diagnose Sjogren's syndrome on its own. No imaging test can. This is where things changed for some people in this situation, not because the scan gave them an answer, but because the scan gave them a reason to keep asking questions instead of accepting the first explanation offered. For some, A scan that did not fit neatly into a typical aging or typical dementia pattern became the reason their care team started looking more broadly, eventually asking about dryness, fatigue, and joint symptoms that had been present for years without ever being connected to the cognitive concerns. If you have ever had symptoms like the ones we just covered, but your standard tests came back normal, or your scan showed something nobody fully explained to you, type the word scan below. That experience, tests coming back unclear or inconclusive, is far more common than most people realize, and it deserves to be talked about more openly. By this point, it should be clear why this particular pattern is so easy to misread. Let us walk through the comparisons directly, because seeing them side by side is often what makes the overlap click. Could it be dementia? Dementia is generally associated with progressive, worsening cognitive decline over time, often involving difficulty with daily functioning that steadily increases. Some Sjogrens-related cognitive symptoms, by contrast, can fluctuate, sometimes improving when inflammation or fatigue levels change, rather than following the same steady downward trajectory typically seen in dementia. This fluctuation is one of the more telling differences, although it is not a reliable rule for every individual case. Could it be Alzheimer's disease specifically? Alzheimer's involves a distinct underlying process in the brain, involving specific protein changes that can sometimes be identified through specialized testing. This is a fundamentally different mechanism than immune-mediated neuroinflammation, even though the day-to-day symptoms, memory loss, and confusion, can look remarkably similar from the outside. Could it be stress or anxiety? Chronic stress absolutely can cause brain fog, memory difficulty, and exhaustion on its own, no autoimmune involvement required. This is part of what makes this whole picture so complicated. Stress can exist entirely on its own, or it can exist as a response to living with an undiagnosed chronic illness, or it can exist alongside autoimmune neuroinflammation, all three contributing at once. Could it be depression? Depression commonly involves cognitive symptoms often described as a kind of mental slowing, alongside fatigue and concentration difficulty. Depression and chronic autoimmune illness are also closely linked in both directions, meaning chronic illness can contribute to depression, and depression can intensify the perceived severity of cognitive symptoms. Could it be multiple sclerosis? This comparison matters because multiple sclerosis and Sjogren's syndrome can sometimes present with overlapping neurological symptoms, including some similar findings on brain imaging. The two conditions require different diagnostic pathways and different antibody testing to distinguish between them, which is exactly why thorough evaluation matters so much when neurological symptoms appear without a clear explanation. The overlap between all of these possibilities is not a flaw in the medical system. It reflects a genuinely difficult diagnostic puzzle. Many of these conditions share similar surface-level symptoms while having completely different underlying mechanisms, different treatments, and different long-term outlooks. This is precisely why a careful, comprehensive evaluation matters so much, rather than accepting the first explanation that technically fits. If your symptoms have ever felt like they did not fit neatly into one single label, type the word overlap below. This is one of the most common experiences among people eventually diagnosed with autoimmune conditions, the sense of being almost diagnosed with several different things before getting a clearer answer. Here is the piece that changes everything once people learn to look for it. Dryness. Throughout this entire video, we have focused on neurological symptoms, memory, fog, confusion, exhaustion, balance, because that is the part most people never connect to Sjogren's syndrome. But the condition's name still carries its most famous association for a reason. Dry eyes that feel gritty or burning by the end of the day. Dry mouth that makes swallowing dry foods uncomfortable without water nearby. A burning sensation on the tongue that does not have an obvious cause. Occasional difficulty swallowing, especially with drier foods like bread or crackers. Individually, these dryness symptoms often get dismissed too. Dry eyes get blamed on screen time or allergies. Dry mouth gets blamed on dehydration or certain medications. A burning tongue gets blamed on diet or a vitamin deficiency. None of them seem alarming on their own, which is exactly why they rarely come up in conversation when someone is sitting in front of a doctor worried specifically about their memory. But when dryness symptoms exist alongside the cognitive symptoms we covered earlier, the picture starts to shift. This combination, persistent dryness paired with neurological symptoms like brain fog or word-finding difficulty, is a pattern that deserves closer attention, because it is far more specific than either symptom category on its own. This is the hidden clue that changes the whole picture, Not because dryness causes confusion directly, but because dryness is often the most visible external sign of the same underlying immune process that may, in some individuals, also be affecting the nervous system internally. If you want the complete pattern guide that lays out how these dryness symptoms and neurological symptoms connect, type the word symptom map below, and we will get that resource to you. If anything in this video has felt familiar, the most useful next step is not panic, and it is not self-diagnosis. It is documentation. Bring a clear, organized record to whoever you choose to consult, because patterns are far more convincing than memory alone, especially memory that has not been feeling reliable lately. Start a simple symptom journal. Keep it as basic as you need it to be, a notes app, a notebook, whatever you will actually use consistently. Track timing. When do cognitive symptoms tend to show up? Morning, afternoon, evening, after physical exertion, after poor sleep. Patterns in timing can be genuinely revealing. Track triggers. Does brain fog worsen during flare-ups of joint pain or fatigue? Does confusion tend to follow particularly dry or hot days? Does anything specific seem to precede a bad cognitive day? Track the cognitive changes themselves, specifically and honestly. Not just brain fog in general, but what that actually looked like that day. Forgot a coworker's name during a meeting. Read the same paragraph 4 times. Got briefly lost on a familiar drive. Track dryness patterns alongside everything else. Eye dryness, mouth dryness, swallowing difficulty, even on days when cognitive symptoms feel mild. This is the connection that so often gets missed when dryness and cognition are tracked separately or not tracked at all. When you eventually sit down with a healthcare professional, bring this record with you. Be specific about timeframes, how long symptoms have been present, whether they have been getting worse, staying the same, or fluctuating. Mention dryness symptoms explicitly, even if they feel minor or unrelated, because that detail is often the one that reframes the entire conversation. If you want the full tracking scorecard that organizes all of this into one simple format you can bring to an appointment, type the words brain map below. Sometimes the body gives clues long before the full picture makes sense. A dry eye here. A forgotten word there. A tired afternoon that turns into a tired month. None of it, on its own, tells the whole story. What looks like aging may be something else entirely. What feels like stress may be carrying more weight than stress alone. What sounds like the beginning of dementia may, in some cases, be part of a completely different pattern, one rooted in the immune system rather than in time itself. This video was not meant to diagnose you, and it cannot replace a real evaluation from a real healthcare professional who knows your full history. What it can do is offer language for something you may have already been feeling but did not have words for, and questions worth bringing into your next appointment if any of this resonated. When symptoms seem unrelated, scattered across different parts of the body, different times of day, different years of your life, that is often exactly when the bigger picture matters most. If this video helped you see a pattern more clearly, the most useful thing you can do is share it with someone who has been quietly worrying the same way you have. Sometimes the right video reaching the right person at the right time changes the entire direction of their story.